The world has suffered a lot for 2 years now, and while we thought we were at the end of the tunnel and could see some bright light, unfortunately it looks like nature is not in agreement. Yes, the corona pandemic is not yet over, and with the new variant Omicron our life might get more difficult. But let's not worry, the human race has always fought adversities, and we know not how to perish. The way we take raincoats and umbrellas before it rains, let's become more cognizant to fight this new variant of coronavirus and show our unity to combat the odds. First, let's understand about the Omicron variant, where it came from, what are the effects and why is it more dangerous than the current coronavirus. Omicron, the recently discovered variant of coronavirus, has made governments across the world anxious because of its rapid transmissible nature. The World Health Organization has already declared the Omicron COVID-19 variant a variant of concern. The variant has sparked fears for the fight against the nearly 2-year-old coronavirus pandemic. As a result, a dozen of countries have brought the shutters down to contain the new phase of the pandemic. Before we proceed to know the Omicron symptoms, our sincere urge for you and your loved ones is to get fully vaccinated if you are not yet taken vaccine or all the doses of boosters. Yours and your loved one's life is very precious, please take care of it. COVID symptoms linked to the new Omicron variant have been described as extremely mild by the South African doctor who first raised the alarm over the new strain. As per the South African doctors, the Omicron patients reported extreme tiredness, mild muscle aches, a scratchy throat and dry cough. Only a few had a slightly high temperature. When asked to Dr. Angelique Coetzee, chair of the South African Medical Association, why the new coronavirus variant is so scary, Coetzee said, "We are not saying that there will not be severe disease coming forward. But for now, even the patients that we have seen who are not vaccinated have mild symptoms. We are quite sure a lot of people in Europe already have this virus." As of now, what the medical community know is this. Number 1, transmissibility. Whether or not Omicron is more transmissible compared to other variants, including Delta, is yet to be known. Number 2, severity of disease. Is Omicron causing more severe disease compared to infections with other variants including Delta? This too is yet to be known. Data suggests that there are increasing rates of hospitalization in South Africa, but this may be due to increasing overall numbers of people becoming infected, rather than a result of specific infection with Omicron. As of now, there is no information to suggest that symptoms of Omicron are different from those from other variants. All variants of COVID-19 can cause severe disease or death, in particular for the most vulnerable people, and thus prevention is key. Number 3, vaccine effectiveness. Vaccines remain critical to reducing severe disease and death, including against the dominant circulating variant, Delta. Current vaccines remain effective against severe disease and death. Number 4, testing. The widely used PCR tests continue to detect infection, including infection with Omicron, as we have seen with other variants as well. Studies are ongoing to determine whether there is any impact on other types of tests, including rapid antigen detection tests. Since Omicron is a virus of concern, there are several actions WHO recommends countries to undertake, including enhanced surveillance and sequencing of cases, share genome sequences on publicly available databases, such as GISAID, reporting initial cases or clusters to WHO. Perform field investigations and assessments to understand if Omicron has different transmission or disease characteristics, or impacts effectiveness of vaccines, therapeutics, diagnostics, etc. Countries should implement effective public health measures to reduce COVID-19 circulation overall, using a risk analysis and science-based approach. So in simple words, at this point in time the medical community has no much information on this Omicron variant, but it is sure to be lethal, so please take care and follow all the guidelines. Godspeed. Please subscribe to our channel and press the bell icon, and let us know in the comment if you want us to cover and bring the Omicron updates to you.